Good morning, everybody, and welcome to Geritalks, episode number 4. Adrian, good morning. How are you?
Doing good, Doctor. Thanks.
Adrian, we're gonna talk about a subject that is very hot these days, and I felt that it was really important, especially for older adults, to be very aware and very well informed about coronavirus.
Correct. It's all in the media. Everyone's freaking out. I've seen it. You're right.
Adrian, we have a very special invite today. I felt that um, infection disease doctor like Dr. Okoli will be the perfect person to help us in this. And let me tell you guys a little bit about Dr. Okoli. Dr. Okoli is originally from Nigeria, where he went to medical school. He did his residency training in internal medicine in Chicago, and then he did infection disease fellowship training in Milwaukee. He has been here in Las Cruces since 2010, and I have known him since then. And he practiced infection diseases here in Las Cruces since then. And he is part of the infection control of most of the hospital here in Las Cruces. Dr. Okoli, thank you very much for coming.
Thank you for having me.
Dr. Okoli, first of all, I would like to tell us a little bit more about you, how you ended up involved in infection diseases, and tell us a little bit about some of the roles that you have done here in Las Cruces since you came over.
Well, I've been here since 2010. I'm from Nigeria originally, and being a tropical country, the most common diseases you see are infections. So on getting to the US and doing residency and fellowship, it just came naturally to me. I understood it easily. Some people may have found it hard, but I found it easy. And so I went to infectious disease fellowship and ended up in Las Cruces. I came here basically by accident, really. I'd never heard of Las Cruces before, but someone told me this community, it's a medium-sized, semi-urban community of almost 100,000 people, and they had not had an infectious disease doctor for 3 years. And I like to feel needed, and so I came here. And I've been here since then, and it's a beautiful place, and I love it.
You know, he was well needed, and he's still very needed for sure. Dr. Coley, let's talk about a little bit more of coronavirus. I guess, as a little introduction, I would like to say that has become obviously an outbreak of the respiratory disease caused by this novel coronavirus, or now that people call it COVID-19, first detected in China, which had been detected now in more than 100 locations internationally, and especially and also here in the United States. On January the 30th of 2020, the International Health Regulation Emergency Committee of the World Health Organization declared the outbreak as a public health emergency of international concern. On January 31st, 2020, Health and Human Services Secretary Alex Azar II declared a public health emergency for the United States to aid the nation healthcare community in responding to COVID-19. So I'm going to go with you, Adrian. I want to see if we can kind of get a clear picture of how many cases we have had so far here in the United States, and some data that we just basically published just a few minutes ago. Go ahead, Adrian.
So, in researching coronavirus here in the United States, the numbers kind of vary. The CDC is where we're going off of because they are the forebearers of information for all of this disease here we're seeing here. What they're looking at having is over 755 cases confirmed here in the United States, with up to 30 deaths is what they're counting right now. Those states showing, it looks like right now all but 11 states are showing deaths from the disease. 45 of these cases of those over 750 are actually had a different outcome. Either 30 of them became deaths, or 15 of them became actually recovered or discharged from the hospital.
Sounds good. And obviously the number of cases have been increasing on a daily basis. As a statement here for you guys to know, right away is there haven't been any cases here in New Mexico. They have, for based on the New Mexico Health Department of Health, they have been 69 people have been tested, and all 69 have been negative. So far, based on the New Mexico Department of Health, we have no cases here in New Mexico. But so, talking a little bit about more of coronavirus, coronavirus is a virus that, is not new for us, Dr. Coley. It's a virus that we have seen before. So tell us a little bit more of what others, what would have known for coronavirus in the past, and what is I guess the different thing about this coronavirus, compared to the previous ones.
All right. Now, so like you said, coronaviruses are not new to us. We in medicine always knew of coronaviruses. And this is a family of viruses called, in medical language, coronaviridae. And it has two members of that family. Now, the coronaviruses in general, they are RNA viruses. Viruses can be either DNA or RNA viruses. So these are RNA viruses. And they tend to cause respiratory infections in humans. Sometimes they may also cause some gastrointestinal infections. And so in 2002, we had SARS, which was severe acute respiratory syndrome. This was caused by the SARS coronavirus, also originating from China. In 2012, we then had another outbreak of Middle Eastern Respiratory Syndrome virus, MERS, and this originated in the Middle East in Saudi Arabia. And so what we have this time, COVID-19, is actually SARS-2 2019 coronavirus. So it originated again from China. And all three of them, SARS, MERS, and COVID-19, actually have their origin in bats. And the coronaviruses, they can jump the species barrier, cross from animals to humans, and they're highly infectious. So,
yeah, perfect. Yeah, they're very interesting. And I think, as you said, coronavirus has been a virus that, has been mainly in animals, in this case, bats. And obviously, first, the epicenter of this outbreak now was found in Wuhan, Hubei province of China, where the first few cases were detected. And there's some linkage to large seafood or live animal market. And I think from there, people got infected and eventually, it went to person-to-person transmission. So I guess the main question, what I'm gonna try to do here for this talk is I'm gonna try to commit some questions, and hopefully the three of us can answer them the best way that we can to simplify it and to have some questions that I know a lot of the public have regarding coronavirus. So I guess my first question will be, obviously the main thing that the fear that I constantly hear patients coming, in the last 2 days here at the office, can I get coronavirus? Can people in the U.S. can get coronavirus? So Dr. Coley, I guess let's talk a little bit more about, are we should be concerned, or who should be concerned of getting COVID-19 today?
well, we should all be concerned, but we should not panic, right? We should not panic. We should just be concerned. And luckily, the things we have to do are not extraordinary things. They are things we should ordinarily be doing anyway. So far, there's been, like you said earlier, there's been no case in New Mexico, but there are cases in the United States. It's a small world, air travel, people move around. And so these days, it doesn't take long for anything to travel around the world, good or bad, be it technology, be it diseases. So it's the same thing. It's here now. If you get in contact with people who already have coronavirus, yes, you can contract coronavirus because it's a person-to-person transmission.
Yes, and so I guess obviously, if you have been in contact, or you have been in countries like China, obviously, those are the people that probably have been more, should be more concerned. But there is other countries right now that obviously they do have become how do you call them, like a risk, for people coming, people have that come from there or they have traveled from there. And I guess based on the CDC, they divide these places, based on the level of how much the virus has spread over there. And obviously, when it comes to they call it like a level 3, and a level 3 is where CDC recommends that travelers avoid all non-essential travel for the following destinations, and those are China and Iran. So for sure, and those, if you have trouble or if you have trouble to those countries, we're gonna talk a little bit about some of the precautions that you need to have. And then in a level three also, when CDC recommends the travelers to avoid non-essential travel to the following destinations, also South Korea and Italy. I believe there's a bunch of cases now in Italy. In my understanding, correct me guys if I'm wrong, but now they have actually, World Health Organization decided that you cannot travel, you cannot come in or get out of Italy. Have you guys heard anything more about that?
Yes, Italy, especially northern Italy, it's very badly hit. And the government of Italy had basically put northern Italy on a lockdown. But I think today they extended that and the whole country is on high alert. But yes, in northern parts of Italy, you're supposed to, life has almost come to a standstill. You're supposed to quarantine at home. Large events have been cancelled and you're not supposed to go in and out of northern Italy.
Yeah. Yeah, and, level 2, and basically CDC recommends that older adults or those who have chronic medical conditions consider positioning travel to the following destination. Like Japan is a level 2, and level 1 being travelers should practice usual precautions to the following destinations is Hong Kong. Otherwise, based on the CDC, so far there's no restriction to travel any other part of the world besides just taking just general precautions. But So I guess the other question, obviously, that we talked about, there have been cases pretty much in the majority of the states. I guess here in New Mexico we haven't had any case, but I think there have been cases in Texas, Arizona, Nevada, and I think in Colorado. So obviously there have been cases all around us. So I would, if you agree, Dr. Okoli, I think just probably just a matter of time, unfortunately.
Unfortunately, it's a matter of time. We don't exist in a vacuum. Yeah. Right now, all our neighbors, we're kind of surrounded by these cases. It's only a matter of time based on movement of people.
So Dr. Okoli, so tell me a little bit. I guess the coronavirus obviously has different levels of disease, if you want to call it. So can you tell us a little bit more? What are the symptoms, or what people should be aware of?
Well, unfortunately, the symptoms of the coronavirus are the same symptoms of the flu or other respiratory illnesses. So most people who contract the disease have a mild illness. And the most common symptoms people have is fever. Then fever, they have a cold, then a cough. A few people have some gastrointestinal symptoms like diarrhea. Many also have fatigue and muscle pain. So it's almost impossible to differentiate the symptoms of the coronavirus from that of the common flu or other respiratory illnesses.
And I think that's the concern part. And I was talking to a patient today, about that we haven't had any cases here in New Mexico. But the reality, I think that the first case probably eventually will be found in the hospital where somebody show up with pneumonia or very severe respiratory disease, and suddenly somebody says, well, we doesn't seems that anything usual. Let's check for coronavirus, and boom, then you have it. But it doesn't mean that there have been a bunch of other people around them that you probably thought that they had the flu, thought that they have a common cold, and by the way, they ended up doing coronavirus or having coronavirus. So I guess, Dr. Okoli, I read that 80 or maybe a little bit higher, the patients with coronavirus, as you mentioned, they'll develop a common kind of cold symptoms, kind of flu. Then like 60% of them will get a little more complicated, and there's potentially a 2% death. I think what they have seen in other countries in other cases. So on those cases that they're become more severe. So what are we seeing in those cases that eventually they get complicated?
Most of those complicated cases are people with underlying medical conditions, elderly people, people with cardiac problems, people who were otherwise immunosuppressed. So these are the complicated cases, which is not surprising, right? Because most viral illnesses, and people may not realize this, but we don't have medication for most viruses, right? Before HIV, when I was in medical school, we actually thought that viral illnesses were self-limiting. So before HIV, we had no treatment for most viruses. And even today, with very few exceptions, apart from HIV, now hepatitis C, influenza, most viruses, we don't have treatments for them. They are self-limiting illnesses. And so it's not a surprise that we're not going to have treatment for this new virus. So most people who get the disease, like you said, have a mild respiratory illness. There have actually been a few cases of people who tested positive but had no symptoms at all. So most people are going to have a very mild illness, which will be self-limiting. It will burn itself out like viruses do. A few people are going to get sick, especially the elderly and those with medical conditions. And these are the people who progress to get to hospital. Some now develop severe pneumonia and respiratory failure and have to be intubated. And a few of those people end up dying.
Adrian, obviously, as Dr. Coley said, the people who are more prone or higher risk, obviously people, older adults, and obviously that's why coronavirus for us has become kind of concerning, but also patients with other comorbidities like congestive heart failure, problems, chronic lung or pulmonary problems like maybe COPD or potentially diabetes, or as Dr. Coley said, patient with some kind of immunosuppression. So, obviously on our population, the patients that you take care, very concerning. Tell us, what are these common things that you're telling, common normal precautions that you're telling people about how potentially to prevent the spreading or getting the disease?
So, in research and what I'm hearing right now is that this disease is spreading more often well, of course, like Dr. Coley said, in elderly population, but also people who are already in the hospitals. If there's a strain of it going around the hospital, then it'll infect people there, or long-term care facilities is what I'm reading just in Washington state alone, with over 23 deaths, mostly stemming from people who were in a healthcare facility is how they contracted the virus. So with that in mind, knowing that it's more of a on the lines of MRSA, when it's since it's contracted more in the medical areas, then it's the same precautions that you would take, but you amp it up a bit. And you, most medical professionals, nurses, caregivers, of course, physicians, everyone does a good job of washing their hands and actually utilizing the masks in a way where they don't spread their germs to anybody who's already, compromised immune system. So in the home health area, in the caregiving world, it's always just making sure that they're washing their hands. And that's why this panic that's happening with people buying out all the masks or purchasing all the hand sanitizers and Lysol wipes, that makes it difficult for us medical professionals to be able to do our job and make sure that we're clean before we go in and see our patients. That makes it really difficult for us.
So I believe, Dr. Coley, that, when it comes to coronavirus, I read obviously when we cough, it's person to person, but, when people cough or talk close to you, there are respiratory droplets that come out. And my understanding is these droplets, they're heavy. They don't travel too much. So I think they're saying that, you usually when you're in contact with another people within 6 feet is probably more or less the distance. Otherwise, they will be hard to travel. They're obviously they're telling a lot of people, well, try not to touch your face, try not to touch your mouth, your eyes, because we're still concerned that potentially it can be contagious by obviously by touching a surface that may be infected and potentially eventually touch your face. However, I think there's still a lot of things that we need to understand well when it comes to coronavirus, because this is at some point, there's some speculation really how contagious it is and potentially how it's going to be, how it's going to transmit it, I guess.
Yes. The spread, like you said, it's a droplet. It's a heavy droplet. It doesn't travel too far. So if you keep a distance of about 6 feet from someone who's coughing, you're likely going to be fine. It's unlikely the droplets will travel that far. Also, you're right. From the experience in China, a lot of the spread was household contact. So the virus does survive sometime in the environment. People who cough into their hands and hold a doorknob. That's why it says wash your hand and don't touch your face. Because if somebody coughs in their hand and turns a doorknob or some other objects, and you place your hand there and rub your mouth or your nose and put your hand in your mouth, you could essentially infect yourself that way.
So, Dr. Okoli, so I guess one of the concerns and one of the questions that a lot of the people has is, how can I help to protect myself? So what will be the common, precautions that people should have, obviously just right now general, that we don't have any major cases, that they have not been in contact with any people with COVID-19. What will be the general precaution they should have?
Yeah, common sense is the most general precaution. Most important thing, wash your hands frequently. Wash your hands. We may have to change some of our cultural practices. Mm-hmm. We may stop shaking hands, at least for now, because that's a way to get contagion from person to person. Mm-hmm. Wash your hands. Avoid large crowds where there will be sick people, especially if you're one of those people who are elderly or you have a medical condition. So those are things you can do. Wash your hands. Don't touch your face often. Avoid large crowds with sick people.
I just had a client. I was on the phone driving over, and a client said, "When we meet, don't be surprised if I don't shake your hand." That's becoming common practice now. Can I ask a question real quick? When washing hands, does any soap work, or does it have to be an antibacterial hand soap?
Soap. Any soap works. It's a physical activity. Any soap works. Okay. Wash your hand thoroughly. Recommended for at least 20 seconds. Sure. So wash your hand thoroughly with soap and water, running water, not in a sitting bowl, running water for about 20 to 30 seconds with any soap. It doesn't have to be antibacterial. Any soap will work. It will develop any soap would dissolve the envelope of the virus. Mm-hmm. So,
what about hand sanitizer? A lot of people are going to have that question. Yeah.
Hand sanitizers are good. Should contain some amount of alcohol in it. So the alcohol hand sanitizer.
I think 60%, that's what I read. Right? Yeah.
So it should contain about 60% of alcohol in it, but nothing beats washing your hands.
Sure. I was told by my immunologist that the hand washing is actually better than actually the hand sanitizer. It's the rubbing motion that kills or gets rid of it better.
Yeah, by far better.
Okay.
So I guess right now, people are coming here every day, eventually with some upper respiratory symptoms, and obviously everybody's concerned about COVID-19. So I guess, if you're sick, if you're sick and you have some respiratory symptoms, I guess, the concern will be, obviously, have you been in one of these countries that, they have been reported to have, COVID-19 outbreaks, number one. Number two is, have you been in contact with any people that you would have known that, that has been diagnosed or have been tested positive for COVID-19? And I would say that, I think one of the general recommendations, correct me if I'm wrong, Dr. Okoli, but if you have been on any of those, either in contact or in one of the places, and you feel sick, please call the office that you're planning to go, or call the hospital ahead of them before you come to the office, so we can prepare for you coming. So would you agree that people should let the hospital, let the offices know about some of the symptoms, some of the exposure before they come to the office? Because one of the main concerns that I had today, to be honest, and I heard it by a patient, said, we're not coming because we know that there's coronavirus, so we don't want to come to the office just because we are afraid of being the spread. And we have protocols here in the office now. But, do you think that it's a common sense to call the office and kind of let them know?
It is good common sense. And we've had the same experience at my office. Some people have canceled their appointments or want us to just give them the labs by the phone, and that's reasonable. Right? I think if you have those symptoms, you should call the doctor's office and let them know so they prepare themselves. And not just that, in Washington State, they actually have changed the protocol for the 911 and emergency responders because you have to ask you if you have symptoms. So if you have symptoms suggestive of COVID-19, then they have to prepare themselves so they don't infect others. So yeah, it's a good idea. Call the office or the hospital, give them the symptoms so they prepare. And all the hospitals in the area have implemented a protocol now. Before they admit people, they have this set of questions they ask to see if the COVID-19 risk is high or low.
So, Dr. Okoli, correct me if I'm wrong, but I think, so I was thinking, that patient comes here. Let's suppose that, I suspect that potentially because of the risk factors, because of where they have been exposed, or potentially, hopefully not, but maybe in the next few weeks, then suddenly have been in contact with somebody who has COVID-19. And they come to the office highly suspicious. We don't have the testing. The testing is available here. Obviously, it's not available to everybody. So my understanding is that right now you have a case that you suspect COVID-19, you need to call your health department, you need to call the CDC, and then they'll decide if eventually the patient meets criteria to be tested. In between, I guess patients should go home, stay home, until they get in contact or somebody gets in contact with them, so potentially guide them on how they can be tested. Am I correct as the case?
You're correct because in mild cases, there really is no need for them to be at the hospital or at the office because there's nothing you're going to do for them. Those who are really sick should be in the hospital. So people are advised to self-quarantine at home until the test is done. And here, I think we've been doing the test here in town now, at least at the both hospitals. We've had patients tested at both hospitals in the last couple of days. Yeah, you're right.
So yeah, I think what for people who are hearing, eventually if there's high suspicions of COVID-19, you need to be home. You need to stay for at least 14 days, and or unless you have confirmed that that's negative. But yeah, as Dr. Okoli said, I think the test is more available, but it's limited to the people who are real sick. Because I think it's gonna be, as you mentioned, when we started this conversation, there's everybody's panicking, and I'm pretty sure that the moment that we start getting a few cases, everybody is gonna want to get tested. And the reality, as Dr. Okoli said, only the ones that meet the criteria will be tested. And as we said before, 80% of the patient with COVID-19 will have a common cold, and and it will be like a common cold. A few days being sick, maybe some cough, runny nose, maybe a little bit of fever, maybe not, and it will go away. And the interesting part of Dr. Okoli, correct me if I'm wrong too, is that obviously when we said that who is at risk, and we talked about older people with comorbidities. Actually, children, they're not much at risk. Am I correct?
Mercifully, yes. Children, for some reason, children seem to be protected. And one of the first cases that was diagnosed positive but with no symptoms at all was a child. So mercifully, children are not, because that would have been terrible because you spread it in school and bring it home to you.
Sure.
So mercifully for us, children are kind of protected.
We're entering the time of year, springtime. Allergies are going to flare up for everybody. I know this. It's going to happen. How do we tell the difference between the symptoms of just your regular seasonal allergies and cold or flu-like COVID symptoms?
I guess with most allergies, people don't have fevers. I think fever is the most common among patients with COVID-19. As high as 80% of them have reported fever. So I think fever is probably the most common. That'll probably help you differentiate between the allergies.
So no need to panic if you got the sniffles and you're coughing and sneezing.
What about the fever?
If you have a fever, that's when you need to consult your physician.
Fever, the cough, body aches. That's when you.
And Dr. Okoli, when you said fever, how high the fever?
I don't have the numbers actually. Come to think of it, I don't have a memory. I don't have it.
I'm just we'll look into a little more, but obviously sometimes there's a little obviously with a viral infection there may be a little bit of mild fever. So I'm pretty sure 99 is not consistent with a concern about COVID-19. Pretty sure it needs to be a fever probably more than 101 at least. Real fever
A
that
substantial
that
fever.
seems to be more concerning. You know, so of course, just for those who eventually, if at some point, we do get people who get sick, and you're sick, and you want to avoid spreading the disease, you know. So as we said, make sure that you stay at home. And I think the definition of how long, I think they're talking about 14 days. Maybe they're saying, maybe until the symptoms get resolved. I don't think that there's a clear definition of how many days you should stay at home, Dr. Coley.
Well, the recommendation for 14 days is based on the experience of the incubation period of SARS and MERS. What they saw in China, the incubation period of COVID-19 is about 2 to 5 days. And I think that by day 8, that's when the symptoms get worse and they peak. But just based on, and this is all new, we don't have so much information, but the recommendation for 2 weeks, that was the outer length of incubation period for SARS and MERS, which were the same sister viruses, so to say.
So and when we talked about the staying at home, again, Dr. Coley mentioned just common sense, like situation like if you cough, please cover your mouth. If you sneeze, use a tissue and throw the tissue to the trash. Obviously clean and disinfect frequently touch objects or surfaces if you're infected, especially when you're at home, to prevent infection from family members that live in the same house. So one thing that somebody asked me today actually is they were gonna travel to San Diego and they were gonna go to a concert. So as far as I know, and I think it has been clear in the public, there's no restrictions of traveling inside the United States. However, there's some universal precautions, like you said, of trying to avoid places that they will be like crowded with a lot of people. I'll be honest, we have plans to do a little vacation. Now we're thinking about it just because we were going to a place that it was going to be very crowded. So we probably felt that it was not the best time to do it. Should we advise people not to travel? Should we advise people? At least I told them that you need to check the CDC. Probably on a daily basis if you're planning for a travel, just for the fact that things may change. We do know that as we talked about those places, especially China, Iran, Hong Kong, Japan, we know that probably is not recommended to travel to these places. I think as we know right now, Italy for the World Health Organization probably is you shouldn't travel. I also read that obviously cruises. Like I thought that I think a lot of the cases that have been reported here in the United States, they came from a cruise. Am I correct?
Correct.
So obviously if you're planning to do these trips, probably these are the times that you should be avoiding these places, crowded places with a lot of people.
A lot of concerts have already canceled.
Canceled,
South
yeah.
by
Conferences
Southwest.
have
Conferences.
canceled.
I had a conference in Washington D.C. next week, and they canceled it.
Yeah.
I think that there are 4 areas of high spread in the United States: Washington State, California, New York, and Florida.
Yeah.
So
That's getting every corner of the
yeah,
United States, right? Kind of boxing
and the
us
4
in.
corners, yeah.
So you mentioned you mentioned about the treatment, and you did mention there's no treatment. But so what people can do if they eventually go get the COVID-19, and obviously is they're in the mild stage, they're coughing, they have a runny nose. What potentially treatment? What they can do to treat this disease?
Well, it's like we do in medicine. Lots of conditions without specific treatment. You do symptomatic management. Take medication to stop fever, medication to stop body ache and watch. But if they get severe enough to get to the hospital, then they may need some support. Depends on what system is failing. If you're having difficulty breathing, you may have to be on supplemental oxygen and advance to that stage to probably ultimately get to be on the ventilator. People who cannot eat, they're dehydrated, we hydrate them. So it's basically symptomatic management.
Correct. And I think that's something that I think is critical for people to know. There is no treatment for COVID-19 or coronavirus. I read that there's already some people in China trying to bring medication, antiviral that for coronavirus, but obviously is in research. There's nothing available now. I think that the same thing they're doing for the vaccine. I think they're trying to potentially bring a vaccine. I wouldn't be surprised that next year maybe a vaccine for coronavirus, but in between, obviously, there's no vaccine, there's no treatment. And as Dr. Okoli said, supportive care, when it comes to supportive and you have a mild problem, it's the same thing that you're treating a common cold. Just, we treat something for the congestion, we treat something for the cough, something for the little fever, for the sore throat. Otherwise, hydrate yourself, stay at home, rest. That's pretty much.
So for the thousands of, or just tons of people who are actually surviving it, because the mortality rate's so low, it's only 2%. So the majority of the people who are actually surviving it, are they surviving it because of their body's natural response to the virus by raising their body temperature and killing off the virus itself? Or how is it that these bodies are defeating it?
Yeah, I think it's the immune response. And like all viral infections, if they're healthy and have a healthy immune system, yes, the immune system kicks in and fights up the virus and ultimately kills up the virus. That's what happens with most of those people. Most of them are young, and problem is if you have an immune condition, you're sick in any way, you may not be able to mount an enough immune response, and then the virus takes over. And for those who get sick and in hospital, yeah, sometimes with viral infection, you may get a super infection with bacterial pneumonia, and that gets treated too. And you talked about treatment. There currently is no approved medication for treatment of COVID-19, but people always get to try something, and this is relatively new. And in China, they tried some medications. Now, it's impossible at this point to say how effective those things were, because those were not randomized trials. And those people, who knows, they might have gotten well on their own. But they tried some drugs, and there's some drugs that scientists know that in vitro, in other words, outside the body in the lab, are active against coronaviruses. But you don't know for a fact that those drugs will be active in vivo in the body. So those studies have to be done. There are candidate drugs already. I don't want to give the names here so people don't start going to stockpile those drugs and take them. Yeah, but there are at least 3 candidate drugs that they already exist. Some drugs to treat HIV, some to treat other infections, right? But there are some candidate drugs, and they're working on them. There's ongoing work on vaccines, and we may get a vaccine, but at least it will take at least a year to do all the trials, make sure the drug and whatever vaccine you get is safe for people.
So all the people who are currently living without the virus, what ways can they boost their own natural immune system so that if they do contract it, they have a better chance of fighting it? Like, I know there's all kinds of the vitamin C. There's a lot of myths and legends of what to eat and what to drink to make you boost your immune system. What do you guys, medical professionals?
Well, I guess, first of all, by far is keeping your body healthy. So obviously sleep well, do exercise, eat well. Make sure that you have any of the other comorbidities like hypertension, diabetes, COPD, heart problems. Make sure that they're stable, they're well controlled. Make sure that your sugars are well controlled if you're diabetic, for sure. There's a lot of supplements there that they tend to seem to increase or enhance your immune system. I'm not a super believer. I do believe that, eating well, probably is good enough. Getting your veggies and getting your balanced diet, well, is enough to give yourself a strong immune system. Sometimes, immune, when it comes with older adults, our immune systems tend to be weaker, obviously, compared to younger people. However, it doesn't mean that it's not strong to fight COVID-19. So I would say that those are the main recommendations from my side, to really fight this disease. And, most of the patients that I see here in the office, they're 65 and older, and some, most of them, they're pretty healthy, and I'm pretty sure that they will fight the disease well. Some of them, unfortunately, they could be a little more at risk. But yeah, again, not because you're 65 and older, 85 and older, or 90 years old, think that, if I get the virus, oh my God, I'm high risk of dying. No, of course not. You can get the disease, fight it well, and with no problems at all. So one of the things that I just wanted to mention is that and when let's talk a little bit about, since we're talking about older adults, and I think this is something that has been kind of interesting for me since I've been involved in nursing homes. Is obviously state of Washington, the nursing home that it was there, 35 residents, 31 infected, 29 or
23.
23 deaths. So that's kind of very concerning for sure. That's creating a lot of movement between nursing homes and nursing home companies, and obviously the CDC, World Health Organization, and the state departments regarding how we're going to prevent potential disease from spreading. I would say that, obviously nursing home patients obviously tend to be very, the most frail, the more vulnerable, and obviously the higher risk of getting COVID-19 and eventually get complicated. So I know that there's the Society of the Post-Acute and Long-Term Care Medicine, that is the association that we follow when it comes to long-term care facilities. They have spread some recommendations on the long-term care facilities, what to do to prevent or to eventually prevent the spreading of coronavirus and prevent death from this from the virus. So, and some of them, they're just common precautions, obviously. The same ones that we have talked before, from the staff and for the residents, like washing your hands, obviously use the common sense, clean and wash surfaces. But obviously they're doing a lot of work, right now, surveillance. But not only the patients, but also the staff. A lot of the staff, sometimes, some of the medical problems, or some of the viruses or respiratory symptoms, or some of the major infection problems that we have in nursing home, they're not coming inside, they're coming from outside.
Correct.
For some of the staff. So I think there's there's obviously working on criteria of how to screen people who are who potentially would be at risk for coronavirus. And there's a lot of recommendation for people obviously who work in a nursing home or in a long-term care facility, if they're sick, to call their employees first before they come to the facility to decide if they can need to be tested or not. Mm-hmm. And I think some of the things that has happened too, and is at least here in New Mexico, and I'm pretty sure in all the states, is that we need to make sure that if you're eventually working in one of these facilities, especially like nursing home, long-term care facilities, hospitals, or even medical offices, and you're sick, don't think that you're going to be punished or you're going to be penalized, or, just because you're saying I'm sick and I'm concerned about spreading the virus. So am I correct, Dr. Okoli, that, obviously, these people, if they feel sick, they should let the employee know, and they shouldn't be afraid of being penalized or anything like that?
Very much so. They should let the employer know, and because there's no need for them to come there and infect the patients, because they're taking care of the most vulnerable. And people in nursing homes, they're elderly. A lot of them have other medical comorbidities. And the problem there, being in a nursing home, they can easily infect others. So if you're sick, let your employer know and see if they can, at least until the illness can be ruled out, so you don't come there and infect the patients and your other co-workers. Right, they should do that.
So it also comes a little bit when it comes to visitors. For sure, there's going to be people coming in to the nursing homes. And I think, some of the techniques or some of the things that they're planning to do is obviously kind of limit, visitors' time. But, if you're planning to visit a nursing home patient, make sure that, there's going to be a consistent with good routine practice. Recommend, there are going to be postings or requesting, people that you have a respiratory symptoms, please avoid from entering the facility, whether or not it's COVID-19. We do it on common sense obviously for influenza season. So for sure, if you have known to be exposed to COVID-19 or have recently traveled to COVID-19 areas, please avoid going to a nursing home. And if there's a community-wide transmission of COVID-19, we recommend facilities to consider screening visitors at entry to the facility. As we said, I think, we, eventually the facility have that right to decide, well, if there's outbreak here in Las Cruces, or, or here in New Mexico, they have the right to decide, well, we may even stop, getting visitors. And I think that's what they did in the state of Washington with that facility. So one thing that I want to talk to you, Dr. Coley, is something that I thought that it was very interesting. You know, can you tell us, if a patient comes to the hospital being diagnosed with COVID-19 positive, you know, what do the hospital needs to isolate this patient? There's like negative pressure rooms. What is the protocol for isolation in these patients at the hospital?
So the patient diagnosed with COVID-19 will be isolated in a negative pressure room. In other words, a negative pressure room is a room where the air from that room doesn't go out to the rest of the building. It's sucked into a ventilator system and gets pumped out. So they have to be in a negative pressure room so you don't infect everybody else in the building. And staff who have to go in there have to wear masks. And it's not the regular mask that people wear. They have to wear the N95 mask, wear their gloves and their gown. And when they're coming out, take those things off on the rules of taking off personal protective equipment and wash their hands. So that's what they have to be in those negative pressure rooms.
Yeah, yeah. And what about, one thing that when I was reading that is that, some of these patients, that they're going to be COVID-19, hopefully they do well. But, I predicting that if it's an older adult, they're going to be weak, they're going to be frail, they're going to be unsteady. So some of them, they're going to end up going to a skilled nursing facilities. If they're still on the maybe less than 14 days there that they ended up, infected, what would be your recommendations for the long-term care facilities that they don't have a negative pressure room? Obviously, they probably need to be on a single room because I think, and I read this, I think it's critical for the facility to understand, first of all, can I take care of this patient? Because they need to be on a single room at least. And do you have the staff to take care of these patients that are going to be requiring probably more care? Would you agree that, at least some of these precautions, same kind of precautions that we do in the hospital, they should be followed in long-term care facilities?
Of course, they should. And I think a facility should know if it can care for those patients. If they don't have a negative pressure room, I don't think they have any business taking those patients. And long-term acute care, they normally have one or two negative pressure rooms. So you have to take patients you can take care of, and the staff there also would have to do the full precautions so they don't get infected.
Yeah. And I think, actually their recommendation now is for the nursing homes obviously to accept patients recovering from COVID-19 only after consulting the local state health departments to make sure that, they have a good protocol and they have a good plan for them and the right precautions to avoid obviously infecting other residents. I'm pretty sure, I haven't talked to them, but I'm pretty sure, some of the administrations here, that's kind of the main concern, that eventually they get somebody, especially what happened in Washington. I think that was pretty drastic and very scary, obviously, for a lot of the long-term care facilities. One thing, because I think people may have been a little bit concerned about, what are we doing to prevent the spreading? What are we doing to prevent a further, a bigger outbreak, or potentially a pandemic? Adrian is going to tell us a little bit, I guess, I was kind of not clear on the definition of pandemic, and I know that some of the people may be concerned about the situation. What a pandemic, and do we have a pandemic outbreak right now?
So definition-wise, we're looking more of a worldwide epidemic, not necessarily a worldwide pandemic. It's getting close. It's teetering on the edge of that. When we're looking at an epidemic, that's an outbreak of disease that affects many in a population and begins to spread rapidly. An outbreak of disease is considered an epidemic if it affects a certain number of people within a short period of time, typically within 2 weeks. So this time span that we've seen where a lot of people got infected really quick, that's an epidemic. When we're talking about a pandemic, it's a larger epidemic. It's a pandemic covers several countries and spreads from one continent to another. So we've already crossed that line. In a pandemic outbreaks, the number of people affected or killed doesn't matter as much as the rate of spread and how far it has spread.
Yeah. So I guess we're not there yet, for sure. So, and I think the CDC and I think the government of the United States have obviously has taken some already some further steps. And my understanding is President Trump actually assigned a team just to have a plan, for preventing and how to treat eventually, potential outbreak of the huge outbreak here in the United States for coronavirus. So, so I guess some of the precaution I'm gonna read a little bit of some of the precautions they have been done is foreign nationals who have been in China or Iran within the past 14 days cannot enter to the United States. U.S. Citizens, residents, and their immediate family members who have been in China or Iran in the past 14 days can enter the United States, but they are subject to health monitoring and possible quarantine for up to 14 days. On March 8, CDC recommends that people at higher risk of serious COVID-19 illness avoid cruise travel and non-essential air travel. And additionally, CDC issued a following, so their travel guidance related to COVID-19 that we already talked about regarding some of the places, that you probably shouldn't travel due to the high risk of transmission. So I guess some of the questions that that I just want to very clarified here, and I know that they're questions that people may have out there, and I saw a question here about should I be concerned for pets or other animals on COVID-19, and Dr. Okoli, I don't know if you want to help us answer that question. People should be concerned about their dogs and cats?
I don't think so.
Yeah. Yeah, and I don't think so either. I guess, this is more person to person. There have no cases being shown that,
What if
they
you have a pet bat?
There you go. There you go. You got me there. Yeah, you got me there. So yeah, you have a pet bat. Not a good idea. We used to have we in the entrance of my house, we had bats, and it was horrible because every single night they will go there, and then we have wano, that's how you say it, wano,
right.
just in the bottom of the front door, and it was like we didn't know what to do. They told us like multiple things of how to get rid of them, but it was a friend of my wife who was kind enough to create like a net to avoid them going to that spot. That was the only way. We used like multiple things. It was, and then eventually it was like a family. We took pictures. There was a family. Hard to get rid of. And very common here in New Mexico, here in Las Cruces for sure. Always concerned about what potentially other diseases can transmit. Mm-hmm. And I'm sure, I'm sure that, Dr. Okoli was very kind on coming with us and talked about COVID-19, but I'm gonna right away redo the invitation for him to join us later for sure, because there are gonna be a lot of topics here, infection related, that I know that a lot of people are concerned. To be honest, we're just coming out of the season of influenza, but obviously that's a very common concern, obviously, for the general population. In this case, obviously, COVID-19 kind of took over, obviously, because of the situation. But I guess, we have talked about, so many things, and I think, very valuable information. I think the main area here is please don't panic. I can tell you, my wife, and I have seen pictures. My wife went to Sam's today, and people are like buying, toilet paper and water and sanitizers. There is like panic about, trying to get. They told me, to get masks, and there's almost impossible. People are making a lot of money, regarding this, trying to sell masks just to create this panic. What it will be your best advice, Dr. Okoli, right now when it comes to COVID-19 for the general population? Should we panic? Should we not panic? What is the common sense here?
No, don't panic. Panic always leads to poor thinking and poor reaction. Don't panic. Use common sense. Protect yourself and your family. Wash your hands. Keep the 6 feet from anybody coughing. If you have a medical condition, avoid crowds and people who may be sick. Be reasonable. Just wash your hands. Don't pick your nose. Stuff like that. It's common sense things. There's no need to panic. At least first of all, we don't have any case here in New Mexico yet. And bear in mind that most people, the vast majority of people who contract this will have a mild flu-like illness. So be concerned about it, but don't panic.
I agree. Adrian, any other comments, concerns regarding coronavirus, some concerns, some other comments that you have regarding, older adults, especially since obviously they're more vulnerable. Any thoughts?
I'm having meetings with all of my caregivers. I have a caregiving agency, a private duty caregiving agency, doctor. And I'm making sure that they're all up to date with the hand washing techniques because we don't want to spread it to that most vulnerable of populations, our senior citizens here in our town. And a couple other things we're doing in the home health world is just making sure our nurses are, doing the right thing by using their hand sanitizers and not spreading germs from one house to another. But I want the general public to know, if you're going to go visit grandma, wash your hands before you go, like everyone is recommended. Don't touch your face as often, and try to make sure that you're cognitive of what you're doing when you're going to go meet with people, especially if you have a little sniffle or you're feeling a little under the weather. It's probably not the best time to visit grandma. Wait till you're feeling better and then go. Keep in mind that population is extremely vulnerable, and we really need to take care of them and not spread this as much as it's already going.
I agree. And just be aware that, there's a lot of information out there. Be careful of what you read, obviously. There's a lot of good information. There's a lot of bad information. For sure, the World Health...
Don't listen to Facebook, right?
Yeah, exactly. World Health Organization, the CDC, for sure, and obviously here in New Mexico, the New Mexico Healthcare Department, right. Obviously by far, they are your sources of information. If you're more concerned, you can visit these websites, and they have updated information on a daily basis. For sure, don't feel free to reach us. If you have concerns, if you have any questions, if you have any other questions, for sure, we'll try to make sure that me, Adrian, or Dr. Okoli will answer some of your concerns. So, please leave some comments or concerns. I guess, I think we kind of wrap it up very nicely. I want to thank Dr. Okoli. Dr. Okoli, I think you have made the difference today for this Geritalks. We do appreciate, for you, the last 10 years that you have been in Cruces. We have been good friends. I do appreciate your knowledge. I do appreciate your help. And thank you very much for being with us today.
Thanks for having me.
Adrian, thank you very much as always. Thank you for coming. And again, guys, let's celebrate aging. Thank you very much. Please remember to listen to us on Spotify and Google Play. Watch us at YouTube at Southwest Center on Aging.
We can't do this podcast without your questions, so please feel free to leave comments on our channel, and we'll be more than happy to research and get back to you guys.
And remember, let's celebrate aging.